test at the ulnar bone. So I'm going to have you just relax kind of all of the weight of your arm in my hand there. Good. And as I come down directly towards the back of the knee, does it start to get tender?
Yeah, a little bit towards the left of the lower, or the right of the lower thigh.
Okay, so kind of here. All right, Brittany, we are going to go ahead and get started with your examination today. Now, I know we discussed that you were here for a follow-up from your dermatologist. Okay, all right. So I do have a note here. It looks like you're on your second round of Accutane, and there were just some concerns wanting to make sure that everything's functioning properly because you're on a pretty high dosage.
Yes.
Okay. So are you experiencing any adverse reactions? Would you say that you've noticed anything?
I don't know if I would consider them adverse, but I have definitely been experiencing some side effects.
Okay, all right. So can you tell me a little bit about what's been going on or what's been bothering you specifically?
Yeah, so definitely overall dryness.
Okay.
I've definitely noticed my eyes are very sensitive to light.
Okay.
Lips and nose are pretty dry. My scalp is very dry also.
Is it? Okay.
I've noticed some hair shedding and breakage, definitely more than normal.
Okay. Hair shedding, so we'll definitely have a look at that.
And then some abdominal and back pain.
Okay. Do those typically come at the same time, or do you feel one and then maybe the other?
That one kind of comes and goes.
Comes and goes. Okay. Would you say that it's mild, fairly severe, just kind of noticeable discomfort?
Yeah, I would say just noticeable.
Noticeable.
Discomfort, pretty mild, but enough to notice.
Okay. And with the stomach pain or stomach discomfort, is there any like gastrointestinal problems? Are you feeling like you're having any indigestion or trouble eating, lack of appetite, things like that?
Yeah, a little bit actually.
Okay. So I have heard that with some patients on Accutane, that it can kind of act as an appetite suppressant, and then, you know, some of the abdominal cramping and stuff. So I'll definitely have a look at the abdominal area, make sure there's nothing going on there. And then as far as the back pain, can you tell me like where is it localized to? Is it kind of everywhere?
Pretty low. Like I would say some lower back pain.
Lower back. Okay. All right. Now I know that you're typically fairly active. Would you say that this has inhibited your ability to like move around? Are you still able to do your day-to-day activities?
I definitely notice in the gym, I get fatigued very easily, and I am just more hyper aware of my joints.
Okay.
Definitely more than normal.
All right. So let's see. It looks like you're almost halfway through your treatment this time around. As a whole, would you say you're tolerating it as well as you did the first time, or slightly better? Do you see an improvement?
I would say I'm actually tolerating it better.
Better. Okay, that's good. So your body has kind of adapted just a little bit?
Yes. They also started me off at a significantly lower dosage than last time.
So we're doing more of a progression this time?
Yes, exactly.
Okay, good.
Last time, I think they just doubled it, and this time they're just slowly moving me
So your body has a little bit more time to adapt versus just kind of going all in the first, especially with your first round. It was probably just a little bit too aggressive. So that's really good. Are you seeing the same dermatologist that you saw for your first round?
No, actually, it's a different one.
Okay, all right. I think we do have that on file. Yeah, I do see that here. Okay. All right. Now you said you're experiencing, some light sensitivity. Is that mostly like with natural light or just like any room lighting?
I notice in the morning when I first wake up, I have to keep my eyes closed for a few minutes. The world is just very bright. And then also at night, driving has become increasingly difficult for me.
Has it really? Okay. Do you wear glasses?
No.
Contacts? No. Okay.
I've never been to an optometrist.
Oh, really? Okay. All right. So I am going to have a brief look inside your eyes. Obviously, I'll try to be mindful of the light itself. The night driving does concern me just a little bit, so I'm just going to take a note here. All right. And then have you been experiencing anything like headache, migraine, pain behind the eyes, lack of sleep?
A little bit of like pressure behind the eyes, I would say.
Both eyes?
Yeah, just more generalized. Yeah, I would just say around like the eye socket, like temporal kind of area, just some pressure.
Okay.
But not enough for me to want to take any.
Okay, so you're not taking any like over the counters?
No.
Okay, good.
And my sleep has been fine.
Okay, very good. So what I'm going to do is just kind of do a good once over. So obviously we're going to focus on the things that you said have been bothering you. I'll have a look at your eyes and then the abdominal region, kind of palpate around, see if there's anything I notice. Most likely, like you said, they're just some kind of side effects that you're experiencing. As long as you're still able to eat, and it can suppress your appetite a little bit, but we want to make sure you're still getting adequate nutrition. I do want to have a look at your back. I know that you're fairly active, so we'll just make sure that's no, injury that's being exacerbated by the Accutane. And then kind of a regular head to toe, make sure there's nothing else going on. Okay. Did you have any other questions or anything you wanted to mention?
No.
Okay. And then I did also want to have a look at your scalp. So you said you've been noticing some breakage.
Yeah.
And would you say that's just of the scalp? Have you noticed anything with your eyelashes or your eyebrows?
Actually, now that you say that, my eyelashes a little bit have been shedding more.
You've
than
noticed
normal.
them kind of like on your face?
Yeah,
okay.
more when I wash my face
Okay.
at night. I've noticed some are falling out more than normal.
Okay, so I will have a look at the eyelashes. I want to have a look at the follicle and see if there's any weakening there.
Okay.
So just notate that as well. Okay. All right, okay, let me set this down and then we can go ahead and get started. I'm going to start with just kind of a basic overall inspection, see if there's anything that I see just from the external region, see if anything concerning is going on there. So, all right, so I'm just going to kind of have a look. Is it okay if I move your hair for a second?
Yeah, of course.
You have beautiful hair, nice and
Thank you.
thick. Now, have you noticed any, obviously with Accutane, you should be very careful with like sun exposure. Are you wearing proper sunscreen? Have you noticed an increase in like sunburn?
Yeah, I've noticed when I'm out in the sun just for a brief period of time.
Okay, very rapidly.
I've been applying sunscreen religiously.
Okay, okay. Do you know what level of sunscreen you're using?
I think it's SPF 30.
Okay, so if you can, I would try to go just a little bit stronger, minimum of a 50, especially on your face, obviously, and then anything that's exposed. 30 is okay, but the longer you're outside, obviously, the more exposed you are. So if you can go a little bit higher, I do think it would be beneficial. So let me just have a look at your overall posture, see if there's anything, especially with the back pain. I always just want to make sure that it's nothing posture related or there's no signs of atrophy here. So I'm just going to kind of come centered here. So at the shoulder, that looks okay. And then nothing notable at the chest wall is even and your elbows are centered. Good. Okay. I'm just going to look at the back of your neck here as well. Okay. Any pain at that back as I palpate here? Does that tender at all?
No, a little on the right side.
On the right side. Okay.
Around there.
Okay. And no recent injuries?
No.
No. Okay. All right. So now I'm going to do the same thing. I'm just going to have a look with my light. So you can close your eyes just so I'm not shining it in your eyes just yet. I don't want to increase any of that sensitivity. I just want to have a brief look here at the skin. Overall, your skin looks very clear, nice and glowy. I know you said you're experiencing dryness, but you must be doing a good job with moisturization because it does look good now. Nothing notable at the neckline and clavicular region is all good. I don't notice any edema here. I will palpate around the lymph nodes in just a bit. You got a little mark here. Is that a burn or just a scar?
I'm not
Birthmark?
sure. I have noticed my skin has been very sensitive.
Okay.
Like tiny little motions will
Kind of leave a
cause-
mark. Okay.
I also noticed on my shoulder area there is just some little, I don't know, I just noticed my skin is just kind of more sensitive overall, like texture-wise.
Okay.
Just since starting the Accutane.
Is there any pain or discomfort or sensitivity with sensation? Like, does this hurt at all,
No.
or that feels okay? All right. So overall, I would say your skin is in a fairly delicate state. Just from the texture, it feels slightly taut, which to me means there's a little bit of fluid buildup, just your body kind of trying to heal and protect, especially if you've had some recent sun exposure. So that is okay, just something to be aware of, that your skin is in a more sensitive state. So we want to kind of just keep track, make sure you're being mindful. Overall, I would say it looks very good. Skin tone is nice and even. Don't notice any sun damage. Just gonna have a look at your hands as well. That looks okay. All right. Nails are very healthy, nice and clean, well groomed. I don't notice any abnormality there. Just a little bit callous. I know you work out pretty regularly, so is that just from like the gym weighted
Yeah.
workouts?
I would say from weights.
Okay. A little scar here. Is that new?
Yeah, I was taking a hot plate at work and I think it just burned.
Okay. Does that hurt at all?
No.
Okay, good. All right, that all looks fine. So you can go ahead and relax there. Another little scar here. That's okay. Okay. All right, so externally, I would say everything looks okay. Obviously, there's just a few anomalies with everyday life. You're gonna bang yourself just a little bit, but that all looks fairly fine. So I think what I'm gonna do now is move on to some palpation. So I'm just gonna start by feeling around. I'm gonna go ahead and put a pair of gloves on, feel around, see if there's anything I'm noticing. And then we can do a bit more of an in-depth look into your eyes. So I like to start up at the scalp, so I'm just gonna feel around. You can let me know if anything feels tender or if it just hurts overall. I'm just feeling for any like lumps or bumps of the scalp itself, and then I will have a look kind of at the hair and at the hair follicle. I just wanna begin by feeling around. Just not feeling anything so far. I'm just going to palpate just along the hairline. Now, I know you said you had a little bit of pressure here. Any pain or discomfort at the temple area?
No.
Okay. I'm just going to feel kind of at the base of the scalp here. Okay. Come around the other side. Nothing at the crown. All of that feels okay. I don't feel any abnormal nodules. Okay. So I'm just going to feel down. So I'm just going to feel down along the neck. You let me know if any of this is tender. Just palpating for any abnormality at the thyroid. Let this feel okay. Okay. Have you had any illnesses recently? Any cold or viruses?
No.
palpate along the arm while I'm on this side. Just a little bit colder at the arm, but that's okay. Alright, I'm just going to palpate here at the forearm. Definitely warmer as we come down towards the fingers, which is good. And no pain in your joints. All your fingers feel fairly normal.
Yes.
Okay. Good. Okay. All right. So come back to the other side. I just want to feel around this side of the clavicle as well as your throat on this side. So again, just having a look at the forearm, feeling around the wrist. I like to look at the joints. That feels okay. Again, no rigidity here at the fingers. Just out of curiosity, when you do your weighted workouts, do you use a strap or are you just lifting with your hands?
No, I'm just lifting with my hands.
Okay. All right, that looks okay. If you ever feel like you're having too much pressure in your hands, obviously I would recommend that you do start using a weight strap, but I think that looks okay for now. Can just put a little bit of increased pressure at the joint. Okay, so now I'm going to have a look at your hair itself. So I'm just going to use my light and start up here at the kind of front hairline. Now you said you were noticing some breakage and some shedding. When you notice the shedding, is it like you're just seeing hair on your clothing, or when you're brushing your hair, when you're washing your hair?
I would say when I wash it and when I brush it the most.
Okay. So definitely when you wash it, that is fairly common because, I'll just be careful with your earrings here. Fairly common because when your hair is wet, it's at its weakest state. So obviously just recommend that you're being careful there. Try to avoid brushing it while it's wet if you can. Overall, your hair is very thick, so even if you are experiencing, a little bit of shedding, luckily you've got quite a full head of hair. It does appear as if it's color treated. When is the last time you had it dyed?
About, I would say 4 or 5 months ago.
Okay. And are you taking a break from the color treatments while you're on Accutane?
Yes.
Okay, good.
I do use some heat on it on a pretty regular basis.
Okay. So overall, I would say maybe due for a trim. Your ends are just a little bit dry, but as a whole, I don't notice that there's anything, super concerning happening.
Okay.
Obviously, the Accutane is going to just dry you out kind of overall, and your hair can be affected by that just mildly, but overall, I would say it's in a very healthy state. Now, you said you use heat on it. Is your hair typically a different texture naturally?
Yeah, it's very curly.
Okay. Even looking at the more highlighted portions, it still looks very well intact. I don't notice a significant amount of breakage, so that's a good sign. Okay. Just gonna have a look at this ear as well. All right. Okay. So let's go ahead and perform a brief examination of the eyes itself. Now you said you've never been to an optometrist.
Yeah.
Okay. Have you noticed any decline in your visual acuity or like your ability to see things, whether it be up close or far away?
No.
No. Okay. I'm gonna go ahead and take my gloves off. I didn't see anything that was really concerning, so should be okay to proceed without them. All right. Now, I do want to have a look in your eyes. I don't want to overdo it just with the light sensitivity. So I'm going to try to keep it brief. I'm going to have you look forward. You can just choose any point on the wall there. If at any point it becomes overly uncomfortable, you're more than welcome to let me know. Okay. So I'm just going to come from this side. You have beautifully colored eyes.
Thank you.
Very good pupillary reactivity, nice and even, consensual and direct responses appropriate.
Thank you.
Good. Okay. Did that hurt at all or cause you any discomfort?
No, but I did notice they started to water a little
Okay,
bit.
so just a little bit of sensitivity
Yeah.
there. Okay, so I'm gonna give your eyes a second. So I have a Snellen chart. Now I'm sure whether or not you've been tested for it, you've probably seen one. So typically we have a much larger chart that we would test at about 20 feet distance. Now this is a pocket chart, so I'm gonna hold it at about arm's length and I'm gonna point to a couple different letters and I'd like you to just attempt to read them for me. So we're gonna start about midway here. Can you read this line?
OLCF.
And if we jump down,
EPTZO.
and can you read the last line?
LTFPH.
Very good. So now I'm going to have you hold this up for me. You can start with either eye. I'm going to have you test that again, and this time we're just going to read the smallest line backwards.
HPFTL.
And if I can have you switch eyes for me, and you can just read it forwards.
LTFPH.
Very good. And then I'll take the occluder from you. If you can tell me what color this is here.
Red.
And here.
Green.
Very good. Okay. So visual acuity is intact. I didn't notice anything that was concerning there. Obviously, if any of that was abnormal, we would do a bit more of an extensive exam, but that does look okay. All right, so I'm going to do a couple different things. I'm going to try to switch back and forth between light and not so that we're giving your eyes a bit of a break. So this time, I'm going to have you follow the light. Now this light is a lot dimmer than the first one, so it shouldn't be quite as uncomfortable. So what I'm going to do is have you keep your head as straight as you can. So we're going to keep our head kind of midline here. I want you to follow just with your eyes.
Okay.
So I'm going to move it around and you're just going to trace with your eyes. Any pressure buildup as we move kind of towards the outer corner of your visual field here?
No.
And if I come in closer, does that cause you any discomfort?
A little, but not too much.
But the further is okay?
Mm-hmm.
Okay, all right. Good. So, what I'm going to do now is show you this. I'm going to hold it up against here so we have a bit of a flat surface. So, I have just a checkerboard here. Now, this is going to help test for any floaters of the vision or if you get any double vision. Okay, so I'm going to hold this here. I want you to focus on that letter. I'm going to move it around and I want you to just focus on that center letter. Does it start to get blurry at all as I move it around?
No.
And no double vision, you're not seeing it twice anywhere?
No.
Good. And if I have you cover one eye, I'm going to make it a little bit harder, taking away the background. So again, I want you to focus here. Let me know if you get any double vision here.
No.
No, no double vision as I bring it closer.
No.
Good. And you can go ahead and switch eyes. Same thing, focus here. Any double vision?
No.
Good. Okay, very good. So lastly, for your eyes, I'm going to test this simply because you said you've never been to an optometrist, so I just want to make sure. Now, it's very likely if you were color deficient, you would know by now, but these are Ishihara test plates. So this one is just kind of an example. You should be able to see that there is a number there. Can you tell me what that is?
12.
Very good. So as I run through, this will both test for your red and green color vision. So can you tell me if there's a number there?
8.
In here?
5.
In here?
29.
In here?
74.
And if I skip way down,
$35.
in here.
96.
And then lastly, I'm going to have you trace this line from start to finish if you can for me. And can you tell me what color the line is
Green.
and the background?
Red.
Very good. Okay. So no suspicion of color deficiency. You did very well there. All right. Just going to set this aside. All right, Brittany, do you ever have any trouble with your ears or your hearing? Any like abnormal earwax, abnormal cerumen texture, or frequent exposure to loud sounds, concerts, that kind of thing?
I would say I go to the gym and I play pretty loud music. I have over-the-ear headphones.
Okay.
That's about it.
How many days a week do you say?
About 5.
5 days a week. Okay. It can be harmful. That's not a lot of exposure time depending on how loud you have it, especially if your phone is kind of alerting you that the audio is peaking. That's something that I would maybe be cognizant of. But the fact that you're aware that it might be a little too loud is usually a good sign. So maybe keep in mind, just bring it down a touch during your like warm up, cool down kind of thing. But I don't blame you. I know it's kind of gets you in the mood to get your workout done. So as long as you're not, you know, combining that with other stressors on the ear, it's usually okay. So I'm going to just have a peek inside the ear. Just make sure this is okay. All right, so I'm going to have you tilt your head for me just slightly here. And you're going to feel me pull your ear back a little bit. You just let me know if it hurts at all. You have very small ears and very petite ear canals here. So I'm going to try to be careful. Okay, so your tympanic membrane is nice and clear. No excessive earwax, and the wax that I do see is perfectly normal in color and texture, so that is a good sign. Okay, that looks good. And all of these piercings look like they've healed nicely. Are any of these recent?
No, I've had them for a few years.
I'm just gonna have a look here. Yeah, that all looks okay. They've healed very well. All right, so just same thing on this side. Is this piercing here for migraines or just for aesthetics?
For migraines.
Okay, do you feel like it's helping?
Yes.
Okay, and how long have you had it?
I got it in about 2016.
Oh, okay, so quite some time. All right. Same thing, I'm just gonna insert. And this side looks good as well. Tympanic membrane is visualized. It is pearly gray, not occluded by any earwax, and the wax that I do see again is perfectly normal in color and texture, so that's very good. You also have very minimal wax. There's not a lot in there. So often a good sign that your music, you should be okay. So typically what happens is once you start to listen too loud, your ears will produce more wax in an effort to kind of protect your membrane, and it looks, you have hardly any wax in there, so it does look okay. All right, so let's go ahead and move on to our next test. All right, so I'm going to do a couple different things. Do you ever have any issues with your nose or like seasonal allergies, or are you allergic to anything that's been, I know we're kind of coming up on springtime now.
I do have
so
some seasonal allergies. I have noticed it has been very, very dry.
Has it? Okay.
So I've been more congested since starting
Okay.
the Accutane.
Okay. All right. So let's go ahead and do a test for nasal patency. So nasal patency, or how patent your nose is, basically is just your ability to kind of breathe in and out freely. So we'll check for any occlusion and see how bad it's affecting you. Also, obviously, in combination with the seasonal allergies, it can be a little bit worse. So what I'm going to do is just occlude one side here, and I want you to just breathe in for me. So it does sound just a little bit occluded to me there. And on this side, that sounds a little bit better. Do you feel like it's worse on the left side?
No.
About the same?
Mm-hmm.
Okay. All right. Just want to have a brief look. I'm just going to peek. So if I could just have you tilt your head back for me. I'm going to make sure I'm not seeing any swelling there, but I think that's okay. Prior to Accutane, did you have any issues with seasonal allergies?
No.
No. Okay. And you said you're noticing an overall dryness. Do you notice that in your mouth as well?
Yes.
Like a decrease in saliva production?
Yes, and my lips are just constantly
Super dry.
dry.
Okay. I'm going to have a brief look in your mouth. If I can have you just open for me. Hard palate looks good. And if you can stick your tongue up to the roof of your mouth and smile with your teeth. Beautiful teeth. Okay, so from what I can see, you are producing saliva. Accutane can definitely decrease that a little bit and just cause an overall dryness, especially your lips are so sensitive. So obviously like a topical, I will say chapstick actually tends to dry you out a little bit more. So if you use something like Aquaphor, that tends to be just a little bit more moisturizing.
Yes.
I often recommend even just like a little bit of olive oil or castor oil, and then you can top it with Aquaphor, and that'll kind of keep the oil kind of penetrating with hydration. Okay. Maybe avoid chapstick just a little bit. I tend to find that it's more drying than anything else.
Okay.
Okay. All right. So we are going to pivot to something just slightly different here. I'm just going to have you identify a couple everyday objects for me. This is just going to test for your cognitive function. Now, I'm going to ask you a couple questions to start with. So, can you tell me what day of the week it is today?
Monday.
Good. And can you tell me where we are?
We're at the doctor's office
Very good. And can you tell me why you're here?
for a follow-up. My prescription.
So just checking your basic, memory, ability to know where you are, place and time, that kind of thing. So that's all very good. So let me just scroll down. Cognitive function. Okay. All right. So I'm going to hand you a couple things. So I'm going to have you close your eyes to start with. And if you can just hold out a hand or both hands. Can you tell me what that feels like to you?
Maybe a puzzle piece.
Good. And now can you tell me how many pieces you're holding?
3.
Very good. Can you tell me what this is and what it's made out of? So the material.
I would say a safety pin and probably made out of metal.
Very good. And if you can just tell me what this object is.
A little hook, I'm forgetting the name of it. A carabiner, I think that's
Very
what it's
good.
called.
And last one here.
I think it's just a smaller version.
Very good. Okay. It's a little trick there, but you did very well. Some people get tripped up that it's the same object, but you did fine. So you can go ahead and open your eyes for me. Next thing I'm going to do is hold out a couple objects, and I want you to just identify the color for me to start with. So can you see this here?
Yes, it's orange.
Orange, good. And here,
Blue.
and here.
Green.
Good. So I'm going to test your blind spot, and I'm going to do that by holding up either of these. Now, let's see. I've got an orange and a blue, and now you already said you were able to identify the color. So what I'm going to do is have you look at a fixed point straight ahead. I'm going to bring them in and out of your visual field, and I'd like you to identify when you see it. So for example, if this comes in, you can say blue. If you see the orange, you can say orange. Okay. So I'm going to do my best to come more behind you here. So we'll start here. You should not be able to see either color.
No, I can't.
Good.
Blue,
Good.
blue,
Good.
orange,
Good.
blue, blue, orange, blue.
Very good. Do the same thing on the other side. Would you say one color is harder to identify than the other, or about the same?
No, about the same.
So same thing here. You shouldn't be able to see either color.
No, I can't. Blue, 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 orange, orange, orange.
Good. Okay. So all of that does look okay. Now I'm just going to have you identify a couple colors for me. So I'm going to pull. I want you to just identify the color as I hold it. So this here.
Yellow, green, pink, green, blue, yellow and pink.
Very good. So we are going to move on now to a test of your hearing. Now, I didn't see anything going on internally of the ears. I'm going to test this a couple different ways. Firstly, I'm just going to kind of make a sound on one side, and then I'm going to whisper a few words on the other side, and I'd like you to attempt to repeat the words. So I'll start with a series of 3. So I'll have you close your eyes just so you can focus a little bit here, and I'm just going to make a sound. Can you hear that?
Yes.
Lamp,
Lamp,
table,
table,
dog.
dog.
Very good. So I'm going to do the same thing on the other side. Door,
Door,
window,
window,
doctor.
doctor.
Very good. So you were able to make all of those out just fine. Now we can go ahead and test with this. So I'm going to have you close your eyes. I'm going to make this sound. I want you to tell me which side you hear it on.
The right side. The left side. The right side. The middle.
So lastly, I'm going to perform one more test, and this time I'm going to make a noise. I want you to tell me if you hear this equally on both sides.
Yes.
Good. And now.
Right side.
And now.
Left side.
Very good. A test for bone conduction. Now you should feel vibration here.
Yes.
And can you tell me if you can hear that?
Yes.
Tell me when it stops.
Stops.
Very good. Same thing here. Do you feel vibration?
Yes.
Can you hear that?
Yes.
Tell me when it stops.
Stop.
Very good. Okay. All right. So your hearing seems to be intact. I don't notice any deficiencies there. So let's go ahead and move on to test a couple of your upper extremity reflexes before we move down into more of the lower body examination. Now, you said you noticed mostly at the gym that you had a little bit of, you were just more so aware of your joints.
Yes.
Is that like you're feeling pain, or just more so you're noticing like the strenuous like aspect of the workout, or what exactly would you say?
A
is
little bit
different?
of both.
Okay.
I've noticed sometimes it just feels like I tweak muscles very easily.
Okay. So
Just very hyper aware of my joints.
and mobility. Okay. All right. So I'm going to go ahead and test the reflexes of your joints and see if there's any diminishment of reactivity. Likely you're just a little bit more aware. When you're on Accutane, your body is kind of in a state of like hyper awareness. So you're maybe just feeling things a little bit more. As long as you're being really careful with your body mechanics, you should be okay. So I'm going to test kind of here at the shoulder. Now this is a very passive reflex. So I'm just going to see right at that joint here. Good. So now I'm going to test at the ulnar bone. So I'm going to have you just relax kind of all of the weight of your arm in my hand there. Good. Same thing at the wrist, just relax. Very good. And then at the third digit here, I'm just going to test for any signs of rigidity. That looks good. Okay, so that side looks okay as far as the reflexes go. Just do the same on this side. Any discomfort there?
No.
Good. So I'm just going to test on this side. This one's a little hard for me because I'm right-handed. Good. A little more reactive on this side, actually. Okay, that was about even. All right. So I just want to do a couple tests here along the clavicle. So this is more so just me percussing. Just want to listen for any abnormality in sound, anything that could indicate anything concerning there, but that does sound good. So just going to do the same thing on the other side, and then we'll test some facial reflexes. And then I'm going to do lower extremity reflexes and have you lay down on the table. So we'll do an abdominal assessment, just kind of brief feeling around, since you said you were experiencing just a little bit of discomfort. And then I do want to have a look at that lower back. And no sensitivity at the collarbone at all, that all feels okay.
No.
All right, so I have a much smaller reflex hammer here. Now this one is just going to allow me to test some reflexes of the face. These are a little bit more passive in that I'm testing for like blink response and just to see if there's any kind of neurological dysfunction here. So I'm just going to move your hair slightly out of your eyes. This will also help test some of that sensitivity since you said you were having a little bit of kind of tenderness to the light. So I'm going to have you look just kind of lazily. You can let yourself blink as you need to. And let me know if this causes any tenderness or if you feel like it's maybe more sensitive than normal. Okay, so good reactivity there. I'm going to turn your head just very slightly just so I can see both eyes, and same thing, you can just allow yourself to blink as needed. Okay. Now I'm going to have you open your jaw just slightly, teeth apart, and just kind of relaxed. Very good. Okay. So all of your reflexes as far as your upper extremity are intact. So I will test your legs. So we'll just do knees, ankles, and then I'm going to have you lay down on the table. So we'll start facing up so that I can do your abdominal exam. I do just want to quickly check at the knees. I'm going to just roll your legs up if that's okay, the pant legs. Just want to be able to have a look at the joint. Just a little bit cold right at the knee and then warmer as we go down towards the foot. And no no pain or discomfort at the lower joints?
No, I have actually experienced some under my knee as of recently,
Okay.
just on my right side.
And was that any specific movement that was causing that, or?
I don't remember hurting it at the gym or anything.
Okay. When you lay down for your abdominal assessment, I will have a look just to see. I just want to palpate around first here, though. As I'm touching, does that hurt at all?
It's just tender.
Tender. Okay.
Yeah.
And is it kind of right behind the knee
Yes.
socket? Like right there?
Yeah, right there.
Okay. All right. So I will have a look at that. I just want to test. So I'm just going to have you relax your leg just very, very lazily. Very healthy reaction there, though. And did that make that discomfort any worse?
No.
Or? Okay. So I'm going to test at the ankle, and this one isn't always as reactive. So I'm going to have you just kind of relax very loosely. Your feet are very, very cold. Not as reactive there. A little bit better there. Okay. So for the Babinski reflex, I'm going to just kind of drag this along the bottom of your foot. It can be a little bit ticklish if you're someone who is rather ticklish, but I want you to just relax your foot. Okay. Not as much reactivity. Your feet are very cold. Can you feel that I'm touching you here?
Yes.
And all of that feels normal?
Yes.
And same sensation in all of your toes?
Yes.
So I'm just going to touch you with this here. I just want to make sure we're having even sensation here. I will check the upper body as well, but can you feel that that's kind of cold?
Yes.
Does that feel the same coldness down the length of the leg? No.
Yeah, a little colder towards the
A
bottom.
little colder? Okay. And here along the foot?
Yes, I feel that.
Okay. And can you feel the bottom of the foot that it's cold?
Yes.
You feel vibration here?
Yes.
Here?
Yes.
And here?
Yes.
Good. Okay. All right. So I'm going to just do the same on the other side. All right. Same thing. I'll just go ahead and roll up the pant leg here. I like this material. Got a little scar on your leg. Looks like a scab. Did you fall or?
I think so. I mean, honestly, I don't really recall.
Okay. Doesn't look like anything significant. Just a little bit of a scrape. And are you having any of that same discomfort on this side?
No.
Okay. All right. So again, I'll just have you relax. Kind of let your weight dangle down there. Good reactivity on this side as well. So your knee reactivity is very strong. The ankles are just a little bit more diminished, but that can be normal. And again, your Babinski is just slightly more relaxed. You do also have a scratch on your foot there.
Could be from the puppy.
Okay. Very likely if you have a small dog at home. Can you feel that this is cold?
Yes.
Does that feel any different coldness as I come down?
Just a little colder.
Colder down here. And at the foot?
Same.
And can you feel it's cold at the bottom?
Yes.
Can you feel vibration here?
Yes.
In here?
Yes.
And here?
Yes.
Good. Okay. All right. All right, Brittany, so let me just set these aside. So I am going to have you get comfortable on the table. We'll start with you facing up. I'll do your abdominal examination, and then towards the end, I'll have you turn around so I can have a look at your lower back as well as the back of that knee. Okay? All right. Okay, so starting with the abdominal assessment, I just want to kind of get a baseline. Would you say right now you're feeling at your normal state? Nothing that you would say is concerning? No discomfort at this time?
Yeah, normal.
Okay. And when you are experiencing some of the abdominal discomfort, is it more so like when you wake up in the morning or just at any given time throughout the day?
Yeah, it's pretty much in the morning and the afternoon, I've noticed.
Okay, all right. So I'm going to do a palpation assessment. Is it okay if I just kind of move your
Yeah,
top?
of course.
Okay. Just move this out of the way. Just right up to about the rib cage there. And then I'm just going to move your bottoms down slightly, just at the pelvic bone. Okay. So I'm going to have a look at the skin as a whole to start with. Skin tone of the abdomen is very even. Do you see just a couple of freckles? That does look okay. I'm not noticing any patchiness or any dryness of the skin here. Abdomen tends to be covered up most of the time, so not as exposed to skin exposure. I'm sorry, to sun exposure. So skin texture, I would say, feels all right. So I'm just going to feel around here. I'm going to start by feeling around the bony prominences. So first starting at the rib cage. Just going to feel both above and below. Individual ribs are palpable, and I'm not noticing any edema here or any abnormal protrusion. That does feel okay. No signs of rib flare, nothing that indicates you're not taking proper inhalation and expiration. That all looks okay. Even at the center, centered at the chest wall, the breastbone. And pelvic bone is centered as well. That looks good. Just going to do a slightly deeper palpation here, feeling around for anything that's just below the surface, any sort of nodules or signs of edema. Looks okay. And deeper palpation here, feeling along for the organs. I feel directly along the umbilicus, feeling for any signs of umbilical hernia, anything that could indicate any straining here at the core. I just feel okay. I don't feel any tightening or any nodules. I'm just going to percuss here manually. Skin elasticity is intact. So we have a nice return of skin turgor here. I'm not noting any diminishment of elasticity or collagen there. That does look okay. All right. So before I palpate anymore, I'm going to do an auscultation with my stethoscope. So this is very cold. I do apologize. You're going to feel just a light touch just like this along the abdominal cavity. I'm going to start here, just at the kind of lateral rib cage. do hear some digestion, which is very good. Just listening along all four quadrants of the abdominal cavity, ensuring that I can overhear normal digestion, any abnormalities of the upper GI tract, as well as the lower intestine. Feel a light tapping, just like this, as I listen. So abdominal auscultation sounds normal. None of that sounded concerning. So I'm going to go in with a little, that same green tool I had you visualize earlier, and this is just going to help me assess for further abnormality of skin texture, any signs of flaking or excess dryness, especially since you are on Accutane and you said you've been experiencing some overall dryness of the skin. Just want to see if there's any severity here. Looks good. So I'm going to test for some abdominal reactivity. Now, similar to the reflexes I tested in your upper and lower extremities, I'm going to start with a very soft sensation, and you don't have to react. I do just want to see if your core is going to engage appropriately. So just to give you an example, I'm going to stroke just slightly like this. And just looking for a certain level of reactivity depending on which stimuli is applied. So of course with the softer sensation we will see slightly less reactivity, but do see that that is present here at the mid-abdominal cavity. And as I come from the side, slightly diminish So I'm going to use the other side of that tool. It's going to feel just like this, slightly blunted. It shouldn't cause you any pain. So you do tend to be just a little bit more reactive on the right side, not quite as much on the left. Very gently, I'm going to test with a sharp response. This typically gives us the most reactivity. I'm going to be very careful not to puncture the skin, obviously. Good level of reactivity there, especially the mid-abdominal cavity. And lastly, I'm going to test with a very, very cold object. So very cold metal here. I'm just going to apply it to the surface of the skin. And again, we'll start kind of here, lateral to the rib cage. Coming in, I'm already seeing a healthy amount of flexing. Mid-core is reactive and engaging appropriately. So from what I can tell, Brittany, there aren't any abnormalities that I'm noting with the abdominal cavity. All of that feels normal. Auscultation was all normal. I do hear healthy digestion sounds. Doesn't appear as if there's any obstruction. So could just be just a little bit of discomfort that's being caused by your Accutane, and then possibly slight change in diet. As you said, you're experiencing just a little bit of loss of appetite. So at this time, I'd like you to turn around on the table for me. I want to have a look at your lower back. Okay? All right, Brittany. So coming in with our back examination, we're going to just be having an overall look to start with. So I will just kind of move your shirt out of the way here. Now, you said it was mostly the lower back that was causing you that discomfort. Okay. So I'm just going to have a look here. See just a little bit of redness of the upper back, so it does look like you may have had some sun exposure recently. It's just a tad warm. I'm going to do just to check with my thermometer here. I'm going to look for any signs of excess heat. Sometimes if we've had a little bit too much sun exposure, our skin will kind of exude heat in an effort to heal the skin more quickly. So I'm just going to test here at the upper back where I see just a little bit of pinkening of the skin. I'm getting a normal reading, though, nothing that's above average temperature variation. Just a little bit warmer here at the low back. Okay, so you have one warmer spot right kind of at the mid-spine. So before I manipulate at all, I'm going to do another auscultation with my stethoscope. I'm going to start here. Just listening for normal respiration, normal breathing sounds, as well as any signs of occlusion or anything that sounds edematous. And then coming down the lower back, I'm going to listen in a linear pattern. Auscultation assessment is normal. I don't hear anything concerning there. I just want to palpate before I perform any external examinations. So I'm just going to start here. Now, is this about where you said you were feeling some of that discomfort?
Yes.
Okay. So I'm going to feel for any signs of swelling, anything that feels particularly displaced. Now, I will say from low back to upper, there is quite a significant deviation in temperature. So it is cooler here as I come towards the lower back and then quite a bit warmer towards the upper. You do have a bit of a hot spot here just at the center though, so just want to feel around here. Does this cause you any discomfort as I palpate around?
No.
I'm going to feel some very gentle percussion with my smaller reflex hammer here. I'm going to go directly along the spine. Sounds okay. Can you tell me if you feel vibration here, Brittany?
Yes.
In here?
Yes.
Here?
Yes.
So this next sensation is going to be very cold. So just to kind of give you a warning here, it can be a little bit startling.
Okay.
I want you to tell me if the coldness feels any different, any of the areas on your back. So in theory, it should feel the same coldness.
It feels the same.
Feels the same. And upper back, does that feel the same as lower?
Yes.
Yes, good. And I'm guessing you should be able to feel that. I haven't noticed any defect in your sensitivity. I just want you to tell me if it feels any different at the upper back.
Yeah, it feels the same.
Feels the same as the lower. And this kind of sharper sensation here at the upper feels the same as the lower.
Yes.
Okay. All right. So I'm just going to go in with my scapular spatula here. I just want to feel for any possible nodules or edematous areas of the back. Flat surface just kind of allows me to feel for anything bumpy that shouldn't be there. Does look okay. All right. Just going to measure the curvature of your spine. So you do have what I would consider more of an aggressive curvature at the lower part of your spine. More so just looking for any signs of asymmetry. As long as the curve is equal bilaterally, then it's not as concerning versus if you had one side that was quite a bit different than the other, but that does look pretty symmetrical, so that's a good sign. And it is spaced evenly at the center. All right. Okay. All right, so as far as your back is concerned, I would say that it is likely that you're just a little bit more hyper aware of your mobility while you're on Accutane. I'm not noticing anything that suggests any sort of injury, aside from maybe just a little bit of warmth here at the mid-back. So what I would say when you're at the gym is just make sure that you're focusing on posture and proper body mechanics, that you're not, you know, bending over improperly. Make sure you're using your legs and you're not bending at the back, and then engaging your core is going to be really important to maintain that proper posture. So I do want to have just a quick look at the back of that knee. All right, so I am just going to raise up your pant leg here and visualize the back of your knee. Just externally, I don't see anything abnormal. I don't notice any swelling. Just going to palpate the surrounding areas here. Is there any tenderness here at the lower calf?
No.
And upper thigh here, any tenderness there?
No, not so much.
And as I come down directly towards the back of the knee, does it start to get tender?
Yeah, a little bit towards the left of the lower, or the right of the lower thigh.
Okay, so kind of here. And would you say it's more centered, like medial, or more directly on, like here?
I would say more centered.
More centered, okay. I'm just going to feel bilaterally here, see if there's any difference from side to side. Would you say this is painful or just kind of tender, or you can just feel a little bit more sensitivity here?
I would say just really tender.
Just really tender, okay. Okay. Just going to test a couple different things here. Do you feel vibration here at the inner knee?
Yes.
And at the outer?
Yes.
Do you feel that same vibration directly at the middle?
Yes.
Temperature all the same here as I come across?
Yes.
So I'm just going to kind of flex just a little bit here. Does it hurt any more or less as I move around at the joint?
No.
Just going to have you push up with your leg on my hand here. Good. And pull down. Good. Okay. So strength is all intact and I don't notice anything particularly abnormal there. I would guess it's either just a small strain, a simple strain from one of your workouts, particularly if you notice that this happened after a lower body workout. Also could just be normal variation. Sometimes we tweak things by just, you know, moving our knee inward or outward slightly abnormally. So unless you're having trouble walking or you're noticing any discoloration of the skin, any signs of erythema or abnormal redness, I don't think this is super concerning at this time. I would say if it does get worse or you don't notice any improvement within the next 2 or 3 weeks, then you may come back in and we can do a bit of a further assessment, maybe get some imaging done at that point. But for now, I would say maybe just try to let it rest over the next few days and kind of monitor for any swelling, but I do think that looks okay. All right, Brittany, well that is going to conclude your examination today. I didn't notice anything that I thought was particularly concerning. Obviously, I did see some of those abnormalities that you were talking about, or those reactions that you were talking about more so to the Accutane, as far as the skin dryness and hair breakage and that kind of thing. Otherwise, I would say your head-to-toe assessment went fairly well. So I will go ahead and document everything accordingly. And if you have any concerns or you feel like any of these symptoms start to exacerbate, you are more than welcome to come back in.
Sounds great.
All right, thank you so much. I want you to go ahead and get home safely.